All right, we're going to be working today on Giddens chapter 38, which is the concept of clinical judgment. Go ahead and grab your concept study guide, version A, and study along with me today. We're going to be defining and describing this concept of clinical judgment, talking about the qualities or attributes of the concept, identifying the way that nurses make judgments in nursing practice, and also just discuss how we use this clinical judgment in nursing and in healthcare in general. So let's start here by defining and describing the concept of clinical judgment. So clinical judgment is an interpretation or conclusion about a patient's needs, concerns, or health problems, and/or the decision to take action or not, use or modify standard approaches, or improvise with new ideas and approaches as deemed by the patient's response. In other words, it's an interpretation or conclusion about what someone needs and what to do about it. Now, there's some different terms here in our chapter: inference, interpretation, decision, clinical reasoning, and critical thinking. So let's unpack those together. Inference means drawing a conclusion about something. Interpretation and inference kind of are the same idea. Interpretation means finding meaning to the information you're given, making a decision, and then clinical reasoning is the thinking process that gets us to the point of making a clinical judgment. While critical thinking is something that we do in nursing, but critical thinking extends beyond nursing, while clinical judgment is specific for the healthcare setting. Now, there's different ways people can approach clinical judgment. A standards-based approach, when there's just best practices and you follow the clear-cut rules and guidelines to patient care. This could be an algorithm. So if you've if you've gone to BLS class and you learn, you check the patient, you call for help, you check their breathing and pulse, and you start CPR. It's the same steps every time. There's no deviation or need to change the plan because you have a standardized approach. Clinical judgment and evidence-based practice is going to combine research and evidence along with a nurse's experience and expertise to put those ideas together. And an interpretive perspective understands that there are so many variations in every situation. And so we really have to interpret the scenario as a whole, and what decision might apply to one situation might not necessarily apply to the next. So what are the attributes of clinical judgment? Well, attributes of clinical judgment include involving a holistic view of the patient situation. Again, taking in all the variables, the family members, the access to insurance, the patient's education level, their vital signs, the screaming roommate next door. There's all sorts of different things that really play into a specific scenario. It has a process orientation, and with clinical judgment, it's not just a linear process where you plan, act, do, and move on. You're always kind of reevaluating, making new plans as the situations change. And it really requires reasoning, which is a thinking process, and then an interpretation of the data. Recognizing that every patient situation is unique. And so you have to have a deep expertise of the knowledge, which is what we teach you in your theory classes, as well as an ability to critically think to apply that knowledge to every unique situation. And so clinical reasoning, that thinking process, leads us to making good clinical judgment, clinical decisions based on the unique situations we find ourselves in. So let's talk a little bit about the ways that nurses make judgments. So in our 110 class, we are going to be spending so much time working through this specific model or theory of nursing here. It's the Tanner thinking like a nurse, clinical decision making, clinical judgment model. And so what we're going to do is we're going to take into account a bunch of different things that we know. We're going to learn a whole lot about medical processes and nursing practice so that we have a good knowledge foundation. We're going to build on our experience and take what we know from our clinical experience as we process clinical judgment decision making. We're, of course, going to be rooted and founded in ethical perspectives, making sure that we're doing the right thing for the patient. And then we're going to take into effect that we know the patient, because every patient really is unique. So we start with this foundation over here in the orange box, and then we work through the Tanner clinical judgment model, noticing. So what data are you noticing for this situation? Interpreting. What does the data mean? And what's my plan? What am I going to do about it? Responding, acting on your plan, making action, taking action, and then reflecting. Reflecting meaning, did my plan work? And did my thinking work that got me to making that plan in the first place? Now let's talk about the context of clinical judgment to nursing and healthcare as a whole. So clinical judgment is an aspect of nursing in all settings. So whether you work in home health, in mother baby, in an ER, an ICU, a clinic, or a triage call center, or as a school nurse, all of these different areas are going to require clinical judgment. But clinical judgment is not required in all patient interactions. For example, if you have a patient who's pulseless and not breathing, you know that the step is to start CPR, and that doesn't need clinical judgment to know how to do that. Or if you work in a post-operative unit and a patient just came from surgery, you know that they're going to need very frequent vital signs and monitoring post-anesthesia, because that's just part of good practice. So you don't always have to think about the clinical judgment to get there. There are some things we just learn and we do because they make sense in all of those situations. Now, the environmental context or the setting of care definitely influences what a nurse can notice. So depending on where you work, you may have different data points. Some patients may be on heart monitors, and some patients on other units may not be on heart monitors. And so the types of data that you're going to get in those different settings is going to be different. When I worked in an ER and a patient came in with a sprained ankle, we could ask the provider to order an x-ray, and we had an idea of whether or not that ankle was sprained. When I worked fast forward to a summer camp, when I volunteered at a summer camp, and then we have to make some clinical judgment whether or not a patient needs to be transported to the hospital for an x-ray, because I don't have an x-ray machine as a camp nurse. So really your data that you can gather varies on your context and where you're working. Not only that, but the healthcare environments are getting more and more demanding, more technology, less staffing, more crunch for numbers. And so those demanding environments of care and the pressures that nurses can be under can interfere with good clinical judgment, because you need some time to think to be able to make those good judgment calls. So the busyness of the career can interfere with that. And that can be a bad thing as we're trying to work through clinical judgment. Finally, experience, knowledge, and expertise. So in order to make good judgment calls, we have to have a basic understanding of medical diagnoses, physiological processes. And so we really do need this body of knowledge. And so the more knowledge and experience and expertise you have, it does make it easier to make clinical judgment. And our goal in this course and throughout your 2-year program is to help you move from being a novice nurse to an advanced beginner, so that you do have some experience and knowledge under your belt to help you make those judgment calls. Now, clinical judgment can be taught. And here are some of those things we can do to develop clinical judgment. Again, growing in our knowledge and deep understanding of these medical diagnoses, pathophysiology, assessment skills, learning to recognize patterns, patterns that we would see in vital signs perhaps, and being able to apply these concepts to nursing practice. This is why we're teaching a concept-based program, so that these big concepts that you learn about infection control or safety, thermoregulation, you can apply what you know of those concepts to a variety of different settings. Skillful responding, that's why we teach you good lab skills so that you can respond with those hands-on skills with patients. And then having a reflective practice. So throughout this 2-year program, I'll ask you to reflect and think on your learning. Think on when you go to clinical and you have a patient encounter. Think when you leave that room, think what went well with that patient and what's an opportunity to improve. So really reflecting on our thinking, reflecting on our education, whether it's in a journal, talking it out with an instructor or with a peer, can really help you develop those clinical judgment skills. Finally, here are interrelated concepts for clinical judgment. Again, clinical judgment is going to kind of permeate everything that you do. So in our program, we're teaching you these concepts, the knowledge you need to be a good nurse. We're teaching you lab skills, the hands-on skills that you need to be able to take action and do hands-on care. And then we're teaching you the clinical judgment so that you can take that knowledge and the good hands-on skills and apply those to any clinical situation you find yourself in to make good judgment calls for the patient. And so we use clinical judgment in a variety of contexts. It's going to interconnect with concepts like patient education, professional identity, leadership, safety, and the list goes on. Now, at the end of your Giddens text, there has some examples. An exemplar is an example of how we're most commonly going to see this concept being used in nursing practice. And so here's 4 examples or exemplars of how clinical judgment is used in nursing practice. In clinical skills, you have to determine what size or type of catheter you're going to use, whether it's a urinary catheter or an IV catheter. And in management of care, if you're a charge nurse, you have to determine what's a safe way to divide up the patient care load. If you have 2 really, really sick patients on the unit who are requiring a lot of time and attention, you probably don't want to give those same 2 patients to the one nurse, right? Or if you've got a really, really brand new nurse on your unit, you may not choose to give them the hardest patient that day. Determining urgent or emergent situations. So what patients need to have attention right now and what patients can wait. Your time, everyone will be competing for your time as a nurse. And so really being able to prioritize your patients safely is a very important clinical judgment skill. And then finally, again, clinical skills, using those hands-on type of care, and we can use that in a variety of settings. Your Giddens text gives an example of a community-based client. We'll be unpacking this more in class, but for now, go ahead and complete that concept study guide, and we'll see you in class. Thanks for listening.